Hi, everybody. Hospice Nurse Julie here.
And Hospice Nurse Penny.
We are together because we're besties, and Nurse Penny is here visiting me because we are.
Changed my mind.
Sorry, hold on. Hold on. We are fixing something here.
We're fixing something. Sorry. This makes more sense.
Okay. So, hi everyone. Welcome. Happy all holidays. It's Easter, it's Passover. Come on in. We're going to be discussing all things death and dying related, hospice related, and just friendship related because we're also friends.
We're also friends.
We met on TikTok, if that's crazy enough. And we are just talking about our retreat too. So we're hosting a retreat in September. And that's it. So come on in.
Yeah. And Sunday. And we're in California.
We're in California. Beautiful sunny California. Where's everyone else coming in from? Please tell me you saw the video of us trying to do some like acrobatic shit and we've hurt ourselves.
We have hurt ourselves because we're old and we were trying to do a trend that 20-year-olds are doing.
I know. Why?
Because we're 20 in here. But
we are 20 in here. We're 20 in here.
20 in here and really
Did you change it or is the cam not flipped? So your pink's on the other side, they said.
Yeah, YouTube actually doesn't reverse it like TikTok and Instagram. When we do our social media, it flips us.
Okay, yeah.
So it's on my left side. So I don't know what side it is on for you. It should be on your right side. But in real life, it's on my left side, which it's showing up on my left side. So this is like a mirror reflection, and social media videos are reversed. So no, I didn't change it. So thanks for noticing.
I know, but your hair looks great. I love it.
Yeah.
So welcome everybody. We're so glad you're here. Nurse Penny and I we're gonna answer questions like we normally do, but we also want to talk about our retreat that's coming up in September. It's actually in person in Boone, North Carolina, in the mountains. Yes. So it's gonna be beautiful.
At the Art of Living Retreat Center, which is a fabulous, probably renowned in the country, I think. A very, very beautiful setting in the mountains of North Carolina in the fall, which is a very beautiful time of the year. Yes. No hurricanes.
Yes.
And it's going to be fun.
Yeah. We're going to have a Friday night like session where we're going like a know me kind of thing. And then Saturday we'll have 2 different sessions. And then Sunday we'll have our final session. Then in between there, you're going to be at a retreat center. So there's meditation, there's yoga, there's just beautiful scenes. You're in a wooded, beautiful area. Hopefully you'll connect with other people at the retreat. You'll connect with us. So it'll be amazing. If anyone's interested, the link is in either one of our bios.
Either one of our bios and on all of our social media platforms.
Yes.
And it's open to everybody. You don't have to be a nurse or a hospice professional. You can be anybody who is wanting to go and meet us in person and talk about death and dying and grief. And like Julie said, connecting with each other is what we're really into also, because we connected on TikTok. We found each other on TikTok and we love each other in real life. We're besties. And so we want to kind of bring our zest for life, because we are hospice nurses and we've been with so many people who died way too young, and we understand the importance of living life to its fullest.
Yes.
And that includes being prepared for death. Sometimes if you can, be prepared for it and understand it, it takes the fear out of it. And it does help you to live your life better if you acknowledge that it's going to end someday. So we're really excited about doing this retreat, and it's going to be fun.
Yeah. We have so much fun together. So if you guys don't already follow Hospice Nurse, so you're on my channel, Hospice Nurse Julie, but if you don't already follow, Hospice Nurse Penny is on TikTok as well. Or TikTok. We're on YouTube.
We're on everything.
Oh God. She's on YouTube.
We're on YouTube here.
We're on YouTube here. And she's Hospice Nurse Penny, but she's also Hospice Nurse Penny, Instagram, Facebook, TikTok, wherever you get your social media, guys.
We're on all the socials.
That's right. So let's get to some questions here.
Yeah, let's do it.
My doctor prescribed 10 milligrams of oxy 4 times a day when required. I'm scared of taking it. Elliot, I get it, but I would talk to your doctor about it. If they're prescribing it to you and you're having pain, you may need it. And a lot of people who start, they'll take something like that for the first time and their pain actually goes away or is reduced. And then you see how beneficial it is to you.
Yeah. And I would also, I'd also want to know what are your symptoms that are being managed, and are you on hospice? Are you, like what is going on?
Right.
And I would also want to know what are your fears around taking it.
Yeah.
That's really important to know too. That is something, like if we know what your fears are around it, we might be able to help address those fears with you. Sometimes people are afraid of taking morphine because how many patients have you had where they read the box and they're afraid to take it because it says it may cause respiratory depression?
Yeah.
And I say, that is why it works for shortness of breath, because it slows the breathing down and it helps people catch their breath. So people have a fear around taking opioids when they're on hospice for a number of reasons. They're worried about the respiratory depression. They're worried about addiction, which is not a worry that you should have.
Yeah,
because you are using it for its intended purpose.
Yes.
You're not trying to get high.
Right.
You will eventually have to take probably higher doses as you adjust to the doses, but that's not an addiction. That's just a tolerance for the medication. And then sometimes people are afraid of the constipation that can happen with opioids, which is a very real side effect that never goes away. And you just need to make sure that you're taking a really good bowel medication for that.
And Elliot did say that they're afraid of their stopping breathing. So that's a real fear, and it's not okay. So I understand the fear. I think what happens is people know about people overdosing, right? And they overdose because they take too much, then they stop breathing, and then you can overdose and die from that. When you are very rarely when you're prescribed medicine like this from the doctor, are they giving you so much that if you took what's prescribed, would you stop breathing? I mean, I just don't. What it's going to do is take your pain away and help you relax.
I think it's also important to address what we're really talking about here. Oxycodone has a stigma attached to it because of the OxyContin thing, right?
Yeah.
But when we're talking about oxycodone, 10 milligrams, 4 times a day, that is the equivalent of 2 Vicodin or 2 Percocet.
Yeah.
That is not a hefty
It's not a hefty dose
at all. I mean,
all.
People will typically come out of a surgery, like when I broke my leg, I was 5 to 10 milligrams every 4 hours of Percocet, which is 5 milligrams of oxycodone along with acetaminophen, Tylenol in it. So people get kind of hung up on the name of what the medication is. And that's where that stigma, the fear comes in, like with morphine. Really morphine has more stigma around it than Dilaudid, and Dilaudid is a higher dose. It's much stronger medication, but yet morphine is the one that gets the bad rap.
Yes. So great question, and we're glad you're here so you can learn. And of course, always consult your doctor that you're working with. They can help ease your fears as well.
So a question for you: why is it that when my stepfather was passing away, he had gasping breathing with the odd holding of breath before he died? I think he was unconscious more than asleep.
Yes. So AJ the Joker, that's a great question. And why was that happening? Because at the end of life, changes in breathing specifically like that, where it looks like someone's holding their breath and then gasping for breath and then holding their breath and then gasping for breath. That's literally what is expected to be seen at the end of life, because as your body is biologically shutting down, it will that's what happens. So it's like the body's slowly shutting down and taking care of itself and allowing it to die.
It's trying to maintain homeostasis as you're dying. It's trying to maintain these balances so that the body can keep shutting down through this systematic process.
Yes.
So those breathing changes are very normal. And you're right. He was not conscious. He was unconscious, not sleeping. That's not what, at the end of life, people aren't sleeping. They are unresponsive. They're unconscious. They're in a death coma. Yes. If you will. They're dying and they aren't responsive anymore. It's not sleeping.
And those breathing patterns that you see are not harmful or hurting or causing them to suffer. They are unconscious. And this is something, how our body automatically does things, even as we're alive, well, and healthy, our body's automatically doing stuff for us. That is how it is at the end of life. And those changes in breathing are not causing any suffering. It's literally an automatic response to the body dying, and the person is unconscious. So it's to be expected, and it's very normal and not causing any distress.
I like this. Psilocybin for existential distress and palliative care can give a totally new level of comfort. Keep an eye on the research. 19-year palliative care nurse. We are keeping an eye on the research. It's in pockets, I think, in the U.S. starting to be tested and trialed. But I know in Canada, they definitely are doing more with psilocybin. But it's not quite in the US yet. But I know personally a lot of palliative care doctors and hospice doctors who are very excited about trying to implement that. This is what I want. I want nitrous. I don't know why we don't use nitrous.
Yeah.
Like, that would be my thing.
Yeah.
Fentanyl and Versed will be my thing at the very end if I'm having a lot of pain. But before I get to that point, I am all about laughing gas, man. I love it. Go to the dentist, load me up.
I'm all about anything that will help ease any kind of suffering, emotional, existential, physical. I mean, why not? I'm very open-minded to all the things. And yes, it is up and coming, and I think we're here for it. I think anyone who works in this area is here for decreasing any kind of suffering any way possible. And I live in Los Angeles, so there's literally like ketamine clinics down the street where you can like pay a doctor to give you ketamine, whether you're dying or not. So
please describe a COPD death. I'm still smoking. Smoking will not help your symptoms. If you're on hospice, we typically say, smoke them if you got them. If you want to smoke, it's not going to help your symptoms, but we don't care if you smoke as long as you're not smoking with oxygen in use, because that is dangerous.
Yeah.
It can cause fire and explosions. But it will make your symptoms worse. Yeah. If you are not on hospice, if you're earlier in your stages of COPD, then quitting smoking is going to be best for you, which I know is hard because I did it myself.
Yes.
But that will be best. But as far as a COPD death, if you get to that point where you are going to die for people who don't know, COPD is a chronic obstructive pulmonary disease, and it kind of is a catch-all phrase for people who have lung-related issues from smoking or exposure to toxic chemicals or anything like that. But typically what you're going to have is a lot of shortness of breath. If it's severe, you could have hypoxia, which can cause confusion, agitation.
And it really decreases so I think this person's being like, help me quit smoking by telling me how bad it is, right? I mean, obviously having COPD, it's a long-term illness too. So you're going to slowly see your quality of life go down, because what it creates is shortness of breath, right? So first it's shortness of breath and you can't run anymore. Then you can't walk anymore. Then it's hard to leave the house. Then it's hard to leave your chair. Then, so we don't want to scare people into like this horrific death. Hospice is here to help you not feel short of breath while you're dying, right? So we can manage and control those symptoms. But as far as like getting COPD, and if you can stop it, it's not a great disease. It's chronic lung disorder, right? So, but as far as hospice being able to manage and control those symptoms, we do the best we can. And we mostly sedate people or give them morphine to help relieve that feeling of not being able to breathe.
Right.
But you still don't have a great quality of life. So yes, if that will help you quit smoking, great. Quit smoking. But we also relate because we both were smokers. We're both ex-drinkers. I mean, we both.
How long has it been since you quit smoking?
Since I quit drinking 7 years ago, but because I was always drinking, then I'd smoke. But I wouldn't consider myself like a smoker for at least 15 years, probably. Yeah.
I quit 30 years ago in October.
Oh, wow. So even when you drank, you didn't smoke?
No, I never started again.
Wow,
no, I quit smoking. Ironically, I quit smoking in October 5th of 1993. And I quit drinking on October 5th of 2020.
Yeah. Wow.
Isn't that weird? That just occurred to me. I didn't even realize that my anniversary dates for quitting smoking and quitting drinking
weird.
are the same.
That is crazy.
Woo. I was a hardcore smoker. I smoked 3 packs a day. I smoked a lot. I was a bartender. And we smoked in the bars back in those days. You could smoke anywhere.
I smoked in the bars too. Yeah. Someone was asking about death anxiety, which I wanted to, because I feel like you're good at that. No, I can't. Oh well.
Yeah, I saw it too. Only asking since you have discussed reset on dying process with PO intake. Elizabeth said, "Oh my God, I'm quitting smoking now. Thank you. Thank you, Elizabeth.
All right.
Thank you for quitting smoking." And let me just say, if you're a smoker and you're trying to quit smoking, remember it takes like an average of 7 times of attempting to quit something before it will actually work.
Yes.
And you don't undermine yourself by smoking and then saying, "Well, I tried." And then, like you have to, if you smoke a cigarette, you just go right back to quitting again.
Mm-hmm.
And I used a 12-step method for not smoking. I told myself that I wasn't going to have a cigarette tomorrow morning when I get up. I'm going to wait until after breakfast to have a cigarette. And then I just kept moving that time out. And so I always say I quit 1 minute at a time.
Wow.
Because then after breakfast, I'd be like, okay, I made it through that. Now I'm going to quit smoking after lunch, or, and then that's literally how I did it.
So here I found the question. So how do you get over death anxiety? I thought knowledge decreases fear, as you always say, but I found that I'm even more scared since my dad passed in December.
Yeah. Well, and here's the thing I think about death anxiety, and I do believe that knowledge decreases fear. And we know from people who tell us all the time that our videos help them with their death anxiety. And I know personally from my own experience with crippling death anxiety that being more connected to death has helped that for me, but it's something that can always rear its ugly head. Mm-hmm. And so even if you're feeling like your death anxiety is relieved more because you know more about it, and then somebody that you love or that you're close to dies, it's going to make that resurface for you. I had death anxiety really bad, became a hospice nurse, did patient care for years and years and years. It went away. Then I went into a hospice quality role where I wasn't doing patient care anymore. And it started to creep back once I got on TikTok, and I started, reliving my hospice by telling stories and educating about death and dying. Even though I still worked in the field, it wasn't doing anything for me until I got on TikTok and really started talking about it more again and connecting with people through my social media, that it was like, oh, it made it like calm back down again. Mm-hmm. And every now and then if it pops up, I think about it. I'm just like, nope, I'm not going to go there. Mm-hmm. I think that accepting that we're going to die is the key to not having death anxiety, because once you can get to that place of acceptance, you can it takes the power away from it. It's like, yeah, I'm going to die. Don't need to be thinking about that. It's going to happen. I have no control over it. What's the saying? I don't own it. I can't control it.
I don't know.
It's
I've heard it.
It's a Naranon saying, I think, or Al-Anon saying.
But also, I was going to say, I don't know how your dad died, but sometimes too, if you had a bad experience or you didn't fully understand what was happening or what you were seeing, like I think of my sister who's really, I think we're all sensitive, but she's really not used to seeing someone dying, right? So if you're not used to seeing it, if you don't know what it looks like, if you don't know what this person is experiencing, or if they did have a somewhat painful death or their symptoms weren't managed, that could cause, I think, more fear in the person watching. So I think getting a little more experience and understanding what was actually happening, or watching our videos in the sense of like, so when you see the changes in breathing, you understand that it's normal and they're not suffering. That can help. That can help.
Perception is key, because I've had situations where, like somebody wrote to my agency and sent a letter about how their mother died a horrible death and it was awful and this and that. And she sent a picture and said, look at her, she looked terrible. And everybody involved in this, reviewing this letter and trying to explore really what the problem was, looked at the picture and said, that's what a dying person looks like. So people who aren't prepared for what it looks like to die are going to be sometimes they'll have a picture of this event that was traumatizing to them, because they didn't know that it's normal to have a death rattle or to have these changes in breathing or changes in color. People they think that their person had a bad death when really they had a normal death. They just didn't know that because nobody told them.
Yeah. And someone just asked about high fevers at the end of life. Yes, that can be normal. High fevers at the end of life.
Yeah. In the last 48 hours, people can have a fever at the end of life.
Yes. 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 Yes.
And the the death rattle, I was researching this again recently. I want to say 82 or 87% predictive of death within 48 hours when a person starts the death rattle.
Wow.
Yeah.
Okay. And if anyone is new here, this is Hospice Nurse Penny. She's not my sister. Someone said, whose live is this? You or your sister? She's not my sister. She is my friend that I met on TikTok because we're both hospice nurses. And now she's visiting me here in California. I visited her out in Washington last spring or summer.
Yeah,
I don't know.
about a year ago.
And so we're doing a live together just because we're friends and we're both hospice nurses and we're both on social media. And because we're doing a retreat together this fall in person, it is limited, like the space is limited purposely because we want to make it small and intimate. So if you like what we're doing, you like talking about death and dying, learning more, preparing more, connecting with other people, we're going to be doing a retreat in North Carolina this September. So the link for that, or even if you're just curious to check it out, just the information and the cost and things like that, links are in our bios. So you can just go to the bio and check out the link, or you can go to my website, hospicenursejulie.com. The link's there. You can check it out there. Because some people don't know how to get to the bio. They're always like, how do we get to the bio?
Oh, I know. Somebody said that to me. Like, how do I get to the bio?
And I'm kind of like, I don't know. I think just click our name, but I don't actually know.
And then I realized it wasn't there and I had to put it in mine.
Oh,
and then you
okay.
have to, like, you're allowed to show 3 or 4 or 5. You can choose how many you want to show. So you got to, and you can move it up to the top. So I did that.
Okay.
And also while you're here on this live, make sure you give us some likes. That helps us in this world.
Oh yeah, that's right.
Yes. And if you're not following Julie already, and you're just popping in, make sure that you follow Hospice Nurse Julie, tap her name, and I'm Hospice Nurse Penny. Give me a follow too.
Yeah.
Can you explain exactly what hypoxia with exacerbated COPD is? Thank you.
So hypoxia just means low oxygen, right?
Mm-hmm.
Hypoxia.
A lack of oxygen to the brain is hypoxia.
Yeah. And it's exacerbated by COPD because COPD is a respiratory disease. So you stop oxygenating as well as you should. So you become hypoxic, which can make you confused, lethargic. And so when you say exacerbated by COPD, that just means it's worsening because of your COPD. So the worse your COPD gets, the worse your hypoxia gets.
Mm-hmm. Yeah. And you can't, and it's hard to treat it with oxygen because you can't use high flow oxygen on high COPD patients because the respiratory drive, like what makes us breathe, gets reversed. So in a regular, let me think if I get this right, and you can tell me if you know.
Yeah.
A person who doesn't have COPD, a lack of oxygen promotes breathing for us. And a person who has COPD, it's the
when you push
presence of CO2 that drives the breathing mechanism. Yeah. So more oxygen doesn't make them
breathe more.
It
makes it suppresses the breathing. But also, even especially very, very end COPD, you like the bottom of your lung, which is where the oxygen exchanges happens. So you can get oxygen to your blood. I'm probably describing it very like layman's terms, but that part of your lung doesn't open up. You're not expanding that part. So that's not happening. So you can pump, even let's just say they do decide to pump all the oxygen in there. 1, it decreases your drive to breathe, but 2, it doesn't matter because your lungs are not opening. That's what ventilators do. Ventilators it's called PEEP. They give you this pressure to force that bottom of the lung open. And you're not doing that at the end of life. You're not intubated. The oxygen, you can pump oxygen all you want, but if your lungs aren't working as they should, it's not going to do anything. So you get hypoxic.
My oxygen is at 92. When will I need to go on oxygen? 92 is okay. People with COPD can live in their low 80s.
Yeah.
They can be in their low 80s and functional. Can a person have fentanyl patches with oxycodone? I'm at home and having pain due to heart failure. The doctors are reviewing my pain. Yeah, fentanyl is a long-acting medication. Oxycodone is a short-acting. So typically we will start people on a short-acting opioid until we get their pain more managed and know what they need for a long-acting, and then we'll put them on a long-acting. So a fentanyl patch would be a long-acting, and then they would still have a short-acting for breakthrough pain.
Yeah.
And then keeping track of those doses is vitally important because that's how we know when we need to increase the long acting is by how much short acting are you having to take for breakthrough pain.
What side? Okay, people are really concerned about this pink. So when I look at Penny, it's on the left side of her face.
Yeah, it's on my left side.
It's on her left side.
That's so funny.
Yeah.
It's backwards because of how YouTube videos are.
Oh my God,
this is like a mirror.
That. Yeah.
This is a mirror. And when I'm on TikTok, I'm switched, in which I also like it on TikTok better because on YouTube, my face looks very lopsided.
Same.
My left eye is like droopier than my right eye.
So Rick, that's a great question. So Rick says death with dignity is illegal in Texas. So how can I make sure I just drug out and not worry about it? So I like to answer this because I think a lot of people just think if you're dying, you're automatically in pain and you need to be drugged out. It's all suffering. It's all awful. Just drug me up. That's just not the case. It can be the case sometimes with some diseases and some personalities. But in general, our bodies are built to die. And if we allow the natural process to happen because of some kind of terminal illness, most of the time, we can control the pain without being drugged out. Like we can, I mean, there's definitely palliative sedation where if people are terminally agitated or they are in severe pain and we can't get it controlled, there's things we can do. But in general, most people die an okay, calm death with minimal management. Like it's not like people need to be drugged out or they need to have the death with dignity to have a comfortable death.
Yeah. Yeah, most people don't. I mean, we were just talking about this yesterday. Most people die peacefully when they die a natural death.
Yeah.
Especially like at the end. Now, getting them there, sometimes there might be a little rough patch.
Yeah.
Young people can have terminal agitation. Like there might be pain that we have to get under control. And sometimes it takes a few days for that to happen.
Yeah.
Or shortness of breath or other symptoms. But at the end, death is always peaceful.
And I think too, what was I going to say about I just think there's a misconception about suffering. Or, I mean, I guess that's all. I think because of lack of knowledge, we think people are suffering or we think, and it's just because we're not around it that much. But in general, because we are around it a lot, or we were at least, in our career, it's not like people think it is. I don't think. And we usually can manage things with minimal interventions. So you don't need to be drugged out.
What do you do if someone is dying and just wants to be high AF? I mean, you can do what you want in your own time, but again,
we're not going to get someone high, but we'll treat their symptoms if they need it.
Yeah. I mean, if you want to smoke pot and get high if you want, we don't care.
We don't care.
We want to know about it, just because it's important for us to know about everything that you're using in case there are any contraindications. We have to educate about risks and benefits and all that stuff, but we don't care that much. Imperial Hot Dog Productions. I like that.
Hello. Hello. We love good hot dog.
Heart failure causes pain. Heart failure mostly causes fatigue and shortness of breath.
Yeah. Swelling in the legs.
You may have pain in your chest a little bit, but mostly what you get with heart failure, swelling in the legs. The legs can be painful if they're swelling. And then fatigue is a very, very common and prevalent symptom for heart failure.
Demanding.
Yeah, we're not going to answer you.
I don't know.
I'm sorry, we can't give medical advice. So if you're asking us about how many milligrams of something you should be taking, we're not the right people to ask.
Going to be asking.
That's between you and your provider.
Yeah.
If they are already on much messier, want more. What? Happy Resurrection Day. My mom's suffering was the 3 months in the hospital before she died. Her passing was peaceful. So good to see you both together. Thanks for the answer.
Julie, how's the romance going? I know, Jenny, I haven't really been keeping up with it either, but so far it's going fine. And Penny met him. So Penny met my boyfriend.
Yes, I met him.
Yeah. And
I'm not going to spill the deets, though.
It's all good. I'm going to sneeze.
Oh, bless you. Oh, bless you.
Woo. Oh, God. It's just allergies. It's just allergies, folks. Yeah, so nice. Yeah, it's been really nice. We'll see how it goes, right? We'll see how it goes. Feet.
Feet.
You want to see our feet? I mean, size 9s, baby.
Size 8.5. Wow.
I love that we just did that. Join us on our OnlyFans. For
our OnlyFans.
For our feet. Just kidding. My Mima died of dementia. Probably. She lived 9 days, no food and water. Glad to know she didn't suffer. Me too. Yeah.
Yeah. And that's normal.
That's normal.
9 days, no water, food. That's right in the window. We typically say 7 to 10 days.
Yeah.
Once a person stops eating and drinking, it can vary depending on what's going on, how much reserve do they have on them. If they're taking sips in between or anything like that. Sometimes if we have them, although a sub-Q infusion isn't going to really hydrate very much.
No.
But I did have a guy that lived 3 weeks without any fluids. He was on a sub-Q infusion.
Oh.
But it was like a milliliter an hour. It was just enough to keep his dying body going for like 3 weeks.
Someone just said they got a commercial in the middle of the live. Yeah, I think YouTube puts ads on the lives.
Weird. Thoughts on people waiting until someone is or is not present to pass away. My grandfather insisted he was not left alone when he was at end of life, so he was not left alone. Well, good for him for being able to verbalize that.
Yeah.
But people sometimes don't want to have anybody present, and they'll wait until everybody leaves the room before they die. And sometimes they wait for someone to arrive or to call them on the phone. We have seen that many times. It's almost like they have some little bit of control over when they're able to finally let go and die.
Yeah. Does insatiable thirst mean anything? My mom isn't eating but a few bites of food, but drinks water like I've never seen. I know water is a good thing, but she drinks it like she's taking a great drug.
Huh. I'm wondering, well, if she's swallowing, that's totally fine for her to be drinking that water as long as she's able to swallow it. And I would say once she's no longer able to swallow it, you're going to want to make sure you do great oral care to keep her mouth moist, because sometimes people feel like they're thirsty when their mouth is dry. And if she's taking any kind of pain medications, those can dry the mouth out sometimes, drugs for secretion. So medications can cause that side effect of a dry mouth, and people will feel thirsty even when their mouth is very dry.
Yeah. Do you see people in hospice who quit dialysis? I am much thinking about doing it at home. Yes, people who quit dialysis can automatically go on hospice, right?
It depends on how often they're getting the dialysis and what stage their kidney cancer or kidney disease is.
So not everyone on dialysis goes 3 times a week?
No.
Oh, okay.
No, sometimes people will go once a week, they'll go 6 times a week, 7 times a week. It really depends on like what stage of their kidney disease they're at.
Okay.
But if you have advanced kidney disease and you're dependent on dialysis, then you can go to hospice.
No, Penny and I haven't done pediatric hospice. I think you've seen a couple of pediatric hospice patients, but like in general, we're neither one of us are in pediatric hospice.
No. Most supernatural, heartwarming death story. Hearing stories about the beauty of moving on helps me cope.
Okay, I have so many heartwarmings. I feel like we both have so many, but like, okay, so I'll try to do mine quickly. So I think I have, in general, what I would say about my experience with watching people die and their loved ones being around is that you really get to see how much love, like it feels like there's like love in the room for, like it feels like you see love in action, and all the love you see doesn't really feel sad. It feels heartwarming to me. I've had, or I don't really know how to explain it, but it feels like I had someone come back to me while they were dying and kind of show me what it was like to die. And it was very, very good. I've had one person kind of come back to life. They were in the actively dying phase, and then came back and lived for another 3 months. She did die 3 months later, but she had, a good 3 months left. That was really, I don't know about heartwarming, but really like miraculous to see. It was kind of crazy. And just in general, seeing the beauty of death, seeing the body naturally take care of itself and allow someone to have a peaceful death, to me feels beautiful and comforting. If you're going to die, which we all are. To me, I feel like I've had way more good experiences than bad experiences.
Same, yeah. for supernatural heartwarming is always going to be my guy that saw his wife coming to get him, and he was crying and he was happy. She died a year before he did, and he could see her in the corner of the room, and he said she was coming to get him, and it was very, very real. Like he really, like I couldn't believe that I couldn't see her. He was just so convincing. He was crying and just, there she is, there she is. That's probably the most supernatural, heartwarming one that I think about. Non-supernatural heartwarming would be taking care of a young woman with her 2 daughters once we finally got her pain and agitation managed with multiple infusions, and helping them to bathe her, wash her hair, and dress her in her favorite t-shirt, and put some leopard print panties on her. Her sister didn't want her in diapers, and I said, cool, we can just put panties on her. We'll clean her up if we need to. And they put like this lotion on her, her favorite good smelling lotion on her. And it was just a beautiful experience.
Mm-hmm.
And then she died the next morning.
Wow. Yeah. Whoa. We missed some here.
Oh boy. For everybody that's new here, make sure that you like this live. That helps in this world. And also make sure if you're not following Julie, you already or are not already following Julie, tap wherever you tap to give her a follow.
And this is Hospice Nurse Penny.
And I am also on YouTube, Instagram, TikTok. We're on all the socials.
Yep. We are not sisters. We are just besties. We're both hospice nurses. We met on TikTok. We're here together at my house, and we're doing lives this weekend and videos together. And we're also promoting our retreat that we're doing in the fall together live in person in North Carolina.
In Boone, North Carolina. And you can register for that. If you can find the links in our bios, it's there on all of our socials. But Julie has a website also, hospicenursejulie.com, and the link is on the front page, right, of that one.
That's right. Yep. Yeah. Someone just said, just clicked on this, and it started with a brassiere commercial, then 2 ladies showing their feet.
That was our feet, but not our bras.
That was our feet, but not our bras.
It's actually pretty amazing that we can even lift up our bodies like that and do that.
I know.
Antics yesterday.
I know.
When we get together, we think that we're 20 in here, and we try to do some serious like gymnast moves in our trending TikTok.
Exactly. And even though we're hospice nurses, we very rarely. We're just laughing the whole entire time we're together.
Yeah, we have fun. It's very much fun, but we almost killed ourselves making our videos. So.
Yeah. Is it much harder for younger patients under 30 versus older? Yes, but I would say people 30 or 50 and and younger.
Oh yeah. So like young, when you're in hospice, it puts a whole spin on what you think is old. And if you have a patient who even sick, I'm 60.
I always think that.
So I've always thought, even as a hospice nurse, when I was in my 40s is when I started hospice nursing. I felt like 60-year-olds were young, and I especially do now because I am 60.
Mm-hmm.
But yeah, I mean, I've had patients that were not, I mean, the youngest was 5, but 19 to 106 was my oldest.
Yeah, 100.
But they die hard too. Like the older ones, like really in their late 90s or hundreds, they do not go down without a fight. I would say they didn't get to be that old for nothing.
That's
true. They have some sheer will and determination.
Personality plays into it too. You can be as old, you can be very, very old and still put up a fight just because your personality is like that.
Oh yeah.
So someone said, I like this question. Curious to see if atheists that work in, are there any atheists that work in hospice?
Yes.
And then see the spiritual side of it? Yes.
Yeah.
I mean,
yeah. Well, I had an atheist hospice nurse reach out to me on my Instagram recently and tell me that they had a belief of some afterlife because of their witnessing of patients visioning at the end of life.
Mm-hmm.
And she's an atheist.
Yeah.
But not all atheists, not all atheists are like, we die and that's it. Some have a belief that we can go on. They just don't believe in a deity.
Yeah. And also people who are dying who are atheists still have I don't even know if we need to call them spiritual experiences. Just they
can vision.
They have visions because that's something that happens at the end of life. So you don't have to be spiritual or religious to have these experiences at the end of life. And even me, like, I think Penny would think this too. Like her and I are not on here being like, people see visions. to make people believe in an afterlife. We both are agnostic or whatever you want. I shouldn't speak for you, I guess, but
I'm the same.
I feel like we know each other well
Agnostic.
enough that like we're just here saying what we witness and what we know, and you take with that what you want. We know what we don't really know. But people who are atheists, it's not like people who are atheists die this really scary death, and people who have a faith don't. It's a gamut. It depends. It's just a gamut. Are you going out to eat at a restaurant? Or are you going to cook at your house, Julie? So I cooked breakfast this morning. We had like a pound of bacon and eggs. And
we're going out for dinner.
We're going out for dinner.
We're eating blueberries.
We're eating sour blueberries and carrots and cucumbers. Like, who are we, Penny? I know.
And then I saw one that said, "Did it hurt when you fell from heaven?" Angels.
Yeah, it did. I hurt my neck and she hurt her back.
That's right.
Or
my knee.
Your knee.
Yeah. No, we that's such a funny to me when people say that we're angels. It's like couldn't be further.
We're both
from
like
the
recovering
truth.
alcoholics and addicts. So
Yeah,
we can't be that big of an angel.
But you also have to have, like you have to have a lot of strength and determination to be able to work with death on the regular.
Yeah.
Like
I do think consciousness continues outside of the brain. I don't know what the heck happens. I don't know, but I do think that.
Mm-hmm.
I'm in my 40s with a neuroendocrine tumor, which is a rare and curable cancer. Mine is metastatic and operable. Have you dealt with end of life with this cancer? I'm on our end. Docs have zero info for me.
I have had neuroendocrine cancer patients.
Yes.
But I don't recall anything about where it metastasizes to.
Same. I have definitely dealt with this type of cancer. I will say I know I've dealt with this type of cancer in hospice, but if it doesn't stand out to me like something crazy, it's probably
not very often, right?
Yeah, not very often. And I wouldn't say, like usually if I see something all the time and I know it's like a quote unquote, like bad, like a disease that has a lot of symptoms or something we had to do a lot for. And that's not what stands out to me. So you could just take the...
Yeah, I don't remember. I'm sure I have had patients with neuroendocrine cancer. I've heard of it, but I don't remember. Like the ones we're more familiar with are probably like lung cancer, breast cancer, colon cancer, ovarian cancer.
Yeah.
I've had some with appendix cancer. That was I had one with tonsil cancer.
Me too, actually.
That's a weird one. I had somebody with what's the kind of skin cancer that people don't usually die from? Basal. Had a basal cancer patient who died from basal cell cancer.
I will say though, Daisy and me, I mean, you're in your 40s, right? So if there's not much to say about it, like if we can't give specifics, I would say in general, look at like the more you can embrace, easy for me to say, right? But what I've learned is like the more you can embrace each day and embrace living in the gray versus like black and white, knowing what's going to happen, what's going to this, but like the better you'll probably feel. There's probably not much to say because it is rare, like you said, right? So finding other people who've had cancer like you or families who've dealt with like that, so you can know what to expect through them. And in general, end of life does kind of look the same. Yes. Depending on what, sometimes it's not disease specific. It just looks the same. Right. So you're going to probably not eat as much. You're going to lose weight. You're going to be tired. You may have pain. You may not. So,
yeah, it does look
there
the same.
There might not be a lot of symptoms that go along with it. Or if you already had a bunch of symptoms, maybe those will continue, and hopefully we can, in hospice, they're great at symptom management. So,
question. Where can I find the information about the retreat? So the links in our bios on all of our social media, but probably the easiest place to find it is on Julie's website, which is hospicenursejulie.com. It's on the front page of that website.
Yeah, you can just click on it.
Click on the link, and it's got all the information in there about registration. It is, we're limiting it to a small group of people. 100 is what we're limiting it to, because we wanted it to be, more intimate. And we are going to be, it's a 3-day retreat. So Friday, Saturday, Sunday, we're doing a meet and greet with questions and answers on Friday. And on Saturday, we're doing 2 sessions. We're going to be talking about, obviously, death and dying. We're going to be talking about grief, connecting. We're going to do some fun little icebreakers. We're going to be talking about 5 wishes.
5 wishes. We're going to try to get you guys to actually leave there with something in concrete writing what you want, so you can give this to your friends and not friends, your family or whoever you feel trusted to give it to.
It's like an advance directive. So we'll be providing this and we're going to help you fill this out. So if you have questions about, do I want to choose tube feeding or do I, like something like that, we'll be answering your questions all about this. We also have some other fun goodies, some books from Barbara Carnes and from Hank Dunn, and it's going to be really fun.
Yeah. The whole point too, like whenever I go to a retreat, I always feel rejuvenated and like connected to the people who are there. So we're going to try to create that kind of atmosphere too. So it feels refreshing and plus you're going to be at this amazing freaking retreat center. I'm so excited just to be there in general.
Yeah, me too. Debbie's saying she has a 5 wishes, but needs to update it. Yeah. It is actually it has been updated. I was noticing as I was going through it with Julie this morning that my version that I filled out is an older version, and this one has more things in it. But it's really cool.
Someone asked if we played an instrument. I used to be able to play the piano.
Same.
Yeah.
Yes.
And you can sing, right?
Yep.
Penny's talented.
I didn't know you played the piano.
I did, yeah. I can still I can like read music.
So can I. Yeah, I can play a little bit. I don't have a piano anymore. We actually had to give our piano away because nobody wanted to buy it. Pianos are expensive when you go to buy one, but you can't
give it away.
You can't even give them away because they're so expensive to move.
Thank you, SoCal Rich. Will you do lives of the retreat? No, we won't.
We aren't going to be able to do that because it's not. Yeah, we're not filming it. It's going to be more interactive than that. We're not going to be like on a stage speaking.
With
we're going to do some of that, but we're going to be, like interacting with people and doing like workshopy type stuff. And we just aren't going to be able to do that, unfortunately.
Yeah, and if this one goes well, we may start figuring out if we can do other ones across the country or, we're trying to figure it out. So.
We actually, before they came to us with this offer to do the retreat, we had been planning on starting to do monthly Zoom meetings with people.
Yeah.
And then we got this retreat thing and neither one of us are like very techie.
Yeah.
Like we'd love to do a podcast. If a producer came to us and said, here's the equipment, we want you to do a podcast. We'd be like, okay. But as far as actually making that happen ourselves,
it's hard.
It's hard.
Yeah.
Am I single? You're beautiful and have thing for nurses. Well, thank you. I am not single. I am married. But thank you. And I'm also old.
Don't listen to her, you guys. And I'm also old. Penny.
I am. Can brain and bone mets pain be toned down to bearable or none? I mean, we can treat brain and bone mets with dexamethasone as a steroid, and it's very, very helpful for bony pain.
Yes, steroids are very, very helpful with bony pain. Methadone's very helpful for bony pain.
Yeah, methadone is really good too.
But yes, you can. And here is the thing. So at the end of the day, hospice is here to control that stuff. So if we can't, I think we need to be very, very aggressive, and not that this is ideal, right? This isn't ideal, but if we have to, we will palliatively, at least we will, our place will palliatively sedate someone. So if someone's awake and in pain and we can't control it no matter what, and we've tried this and we tried this and we've done all the things, we will palliatively sedate someone so they're not in pain.
And we do work with people as far as, like what is really tolerable to you. If we can't get you to a 0, which may not happen, what would be tolerable for you? And that's how we try to work toward you. You may not ever have 0 pain, but we will get it as close to tolerable as we can. And then for those who really are just pain out of control, and we just aren't getting on top of it, then we can do palliative sedation. But we don't really have to do that very often. Like We don't really do
No,
a
we
whole
don't
lot
have
of
to do it.
palliative sedation.
No, we don't. We don't.
It's usually people who are young, who just have just a lot of cancer,
terminal agitation, seizures, a bunch of stuff.
Yeah, like a lot of
But
things
very
going on.
rarely.
It's not something we do on a regular basis. It is a trick that we have that we can resort to. Like we just recently did it for a young woman who she was just on a lot of medications and she was still really having a lot of pain. And we don't do palliative sedation until a person is very close to the end of their life. We don't start that early on. That's usually in the last, when we're like at the last week of life. And people who have cancer will often have a pain crisis before they die. Like before they get to that end point, they can have a pain crisis. That's very common.
So I think, so I feel like it's kind of getting a little, do you want to end soon? I like cut out after like an hour. I'm like done.
Yeah, we've been almost on for an hour.
Yeah. Only because too, they can rewatch this.
Oh yeah, that's true.
Yeah.
What if food will come up and pour out of their noses in the sleep? It will be off. Yeah, that isn't something I've ever really seen.
No. Is it true you can choose palliative care years before your death if you have an incurable disease?
It depends on the agency.
It depends on the agency, yes. Palliative care, some places you can be on it, and some places you need to have less than a year. Or until they think less than a year. It just depends.
Yeah.
Just depends.
And then there's pain clinics. Some people do pain clinics. You know, it really depends on what your symptom management needs are.
Yeah. Okay, you guys, listen. So just to review, this is hospice nurse Penny. She's on YouTube. She's on TikTok. She's on Instagram. She's on Facebook. On all the things. I'm hospice nurse Julie. I'm on all the social medias too. We're both hosting a retreat together this fall. You can find information for that in our bios. There'll be links to it. And also you can go to hospicenursejulie.com where you can see the link to that too. So if you guys are interested in coming to our retreat, check it out. If not, just check out our videos and hopefully we can help answer questions. If we didn't answer your question today in the chat, I'm sure we both have hundreds of videos you can go through if you wish, and hopefully we can get your question answered there. And anything?
Nope.
Okay.
That's about it.
All right.
We're gonna
Thanks,
go have
guys.
some fun in the sun in California.
That's right. Bye,
Bye,
everybody.
Thank you.
Happy holidays.
Happy holidays.
Bye.
Happy Easter.
Happy Easter.